Sitting kills more people globally than smoking does, and smoking, the box comes with a sign that says it is injurious to health and it kills people, but sitting creeps up on you, inactivity creeps up on you much faster. Obviously, I don't need to give you the research. It is in the newspapers every day. WHO is telling you, Lancet is telling you, the Prime Minister is telling you, the GST department is telling you, the Health Ministry is telling you. Everybody is raising the same alarm, same research, that we do not have the health infrastructure to cater to a population if they fall ill. We need to prevent illness, and the cost of illness is rising every day. And 1 in 3 Indians currently suffer from preventable lifestyle diseases. 63% of our deaths are because of non-communicable diseases. 50% of Indians don't meet adult activity levels as prescribed by WHO, which is only 150 minutes of working out in a week. For this, obviously, the Prime Minister has launched many campaigns, which were the biggest sponsor of the Fit India movement with the Honorable Prime Minister. He's also launched the anti-obesity movement. He's also launched the Eat Right India movement. And he's also launched Halo India. All of them are trying to make India understand and the youth understand that we need to be active. And a recent report by Dalberg tells you that if India could only get active, we will add 15 lakh crore. Please focus on that number, 15 lakh crore every year to our GDP. So not only do we benefit as a country, but as an individual, I become healthier, my family is happier, my income goes up, and my GDP goes up, and the cost of health decreases for us as a family and a society. So the biggest medicine that India has today, especially given the population, this age where the average age is 28 for the population, fitness is India's cheapest medicine. And FitPass is the prescription. I don't think I need to explain to you how big the market is. Today, we're standing at a precipice where after COVID, this has exponentially grown. We're projected to become a 37,000 crore market. I think this has also been highlighted in the new GST regulations, which I'll come to, which is our innovation, and we've been working with the government for it. So what I was telling you about was, what is the solution? The solution is FitPass. What has FitPass done? We're the only company in the country that brought everything that is required for prevention together as one subscription. So access to activity. So a network of 8,000 gyms and fitness studios. And exercise and nutrition have to go hand in hand. So daily nutritionist support, unlimited doctor consults, and AI fitness coaching. When everything comes together and you bring data-led interventions, that is when you start nudging people to lead healthier lives on their own terms. There is no set definition, but the science is common, that just how medicines behave with your body, that is how good nutrition and exercise behave with your body. It doesn't matter where you work, what you do, where you deploy your skills. The way fitness and nutrition work for your body the same way any allopathic or homeopathic or Ayurveda medicine does. So this is who we are. We're an all-you-need fitness membership, which has simplified everything that you ever needed to get fit, stay fit, feel well. So access to gyms, AI fitness coaching for home workouts or at a gym, nutrition assistance so you can marry the two, virtual classes, activity tracking, and of course, in case you fall ill, then talking to doctors, unlimited health checkups, etc. What are the innovations? First innovation, the most disruptive, is our business model. So India didn't need more gyms. So we took a capex light model, which is very similar to Airbnb and Uber. India already had gyms. They were empty.
Sorry to interrupt, Mr. Akshay. Just a prompt. 5 minutes are remaining for the presentation.
I can see that. Thank you for the prompt.
Sure. Thank you.
So India didn't need more infrastructure. Capex was not the problem. And the same example there is in the airline industry also. More airlines were not needed in the country. Getting people to sit in those airlines was required. And that is when an economy grows or a market expands. And that is what we did. So we didn't need to build infrastructure. We needed to make sure idle infrastructure gets utilized. So people demand activation happens, citizen participation happens. And everybody who's invested capex can start generating ROI, because that's when the ecosystem flourishes. So our business model is a shared economy business model. Because we're a tech-led operator, we can lower prices, which will increase demand. Therefore, more gyms and more studios will get utilization. Thereby, we are able to control quality. And as the gyms start doing well, more gyms open, which means everybody has a gym nearby or has nutrition and has access nearby. And therefore, because there's competition, prices will lower again. And this is the shared economy virtuous cycle that produces the results that we need to. Today, because of this innovation, we have become the only player that is bringing fitness to a customer's life from every which way, whether it is bank credit cards, insurance products, wearables, travel, hospitality. And the other big innovation that we did is we've been working with the government to change regulation. So I'll quickly tell you, the first time I started working with the government was 2017 when the Honorable Finance Minister then, Mr. Arun Jaitley, called me. And this is the letter. And then we got first in 2018 GST came. We lobbied to get GST from 28% to 18% on gyms at that time. And today from 18 to 5. Thereby, even the government recognizes the role of fitness and nutrition as a core preventive health pillar. Also, we were the only guys who helped government understand during COVID that you needed to bring fitness as part of health insurance. Otherwise, health insurance was doing nothing to take care of your health. 4th of September 2020, smack in the middle of COVID, our regulation came where the government said, okay, yoga centers, gymnasiums, sports clubs, fitness centers must be covered under health and life insurance policies. And FitPass was the only approved player by the IRDAI. So today, FitPass comes to you as part of every insurance product that is sold in the market. So suddenly our go-to-market became so high and so efficient that today millions of Indians are getting access to fitness without them actually realizing how affordable it has become. Our comparables are largely globally. Nobody in India has our fitness model. Everybody globally, one is called Gym Pass, Class Pass, Fitness Passport, and we have FitPass. All of them are unicorns. I think we're the only ones that are profitable and at scale. Obviously, the market is in India. Domestically, you wanted to know what is the difference. The difference is everybody solves in silos. Gyms only make gyms. Studios only do studios. Nutrition or dietitian only do nutrition. Nobody combines everything. Your body needs a combination of exercise, activity, data, nudges, and health checks to know your baseline and how it's improving. All of that is combined only as part of our solution. The impact that we're having, I think it is quite clear on the nation, is the fact that the government listens to us and has been listening to us since 2017, repeatedly helping us make fitness more affordable. Obviously, with a young nation, there is no choice but to keep them healthy, but to keep them secure. Because if people fall sick, and in COVID, we saw that, right? Everybody asked you, it didn't matter how much money you had or what title you commanded in society. The only question the doctor asked you was, do you have a comorbidity? If you have a comorbidity, you need to get admitted. What were the comorbidities? Diabetes, hypertension, obesity, mostly preventable lifestyle diseases. And the government understood that if our country falls ill, we don't have enough hospital beds or health infrastructure to take care of them. And if we want to become a $5 billion economy, if people fall sick, they buy medicines. They don't buy consumer goods. So prevention had to become a core pillar. And the definition of health, even with the government agencies, started changing. Obviously, this aligns with the larger UN goals, UN Sustainable Development Goals, where our model helps people in 573 cities today access fitness and nutrition. So whether these are ladies, homemakers, people aspiring to join the NDA, we serve 60 lakh members a month. 60 lakh is a huge number for India. So this is who we are. Obviously, advocacy is a big part of our innovation, gender inclusiveness, corporate India. So yeah, that is what we wanted to tell you. And I thought it was only a 2-minute conversation. Thank you for your time.
Thank you for the presentation. Now we are open for the Q&A session. Jury can ask the questions.
Dr. Srivatsava is going to ask. Is sir there? Is Dr. Srivatsava there?
Yeah, he's there, but he's on mute, ma'am.
Sir,
Am I
sir?
audible now?
Yeah.
I am audible.
Yes, sir.
Yes, sir.
This is a model which you are trying to promote as a preventive model and promotive model. There are other models which are available, which are part of the health promotion campaign in various other areas. Do you have any comparative study?
So I couldn't understand. Your voice is very unclear, but I understood till there are other models. Yes, there are other models, definitely. What was it after that you asked?
Have you any type of comparison of the outcome with those models?
Yes, sir.
There is
I
a
think,
physical model which is
yes, sir. So I think the outcome is, there are multiple ways of assessing
there
outcome.
is a physical model which is available.
So we are not a physical model only. We are a tech model actually, where we don't own CapEx. We don't build
No.
chips.
Are you getting my point? I'm a medical doctor, so I am worried about the outcome,
Yes, sir.
whether it comes from a digital model or from a
Yes.
physical model.
Yes, sir. Yes, sir. And those
That is none of
outcomes,
my concern.
yes, sir. So those outcomes, there are several studies that,
My concern is if I have gone, just hear me. If the
so sorry, can you guys hear him? Because I can't hear his voice.
patient will I realize, okay, you better go to the next jury.
I
Maybe my
think, sir,
connection at present is not
yeah.
working well.
No, that's fine. I understood what sir wants to ask, maybe to a level. Sir is from clinical perspective. He wants to know whether your model is physical model, what, because you're talking about
Yes.
your preventive and promotive.
Yes.
Have you done any comparison of the outcomes which have come out of
Yes.
your model
Yes.
with the earlier one?
Yes.
Have you done it?
Yes, not only have we done it, IRDAI sanctioned BCG and EY on their own monies to do this. In fact, DFS, Mr. Debashish Panda, who was the DFS secretary and then became chairman of IRDA, he sanctioned it. And there was a 3-year study that was taken of insurance customers, one who were using our program versus those who were not using our program.
Has it been published?
So
The next question.
it is IRDA's proprietary, but the outcome is the regulation. The outcome is that it must be included. The government doesn't bring regulation without validating a hypothesis. And then discounts to be provided to those who follow this regime, telling you that those guys are healthier, so must get incentive. The outcome is exactly this regulation. And the second outcome is exactly the Honorable Prime Minister, Mr. Narendra Modi, reducing GST from 18 to 5% on fitness. Fitness today is not even an industry. It is not even classified as an industry in the government by the government of India. Yet that was brought about simply because of all these papers that we have published with the government. We are not published, but the government has done research with us. And one more person who will have this research, and since you are part of the government, you can ask them, is the GST Tax Policy Research Unit, TPRU. They also did a study because only they recommend a change to the GST regime. So you may ask the Joint Secretary, I think his name is Mr. Sachin or Mr. Bala, they sit in the North Block. They did a study for 18 months to figure out how it impacts, how our program impacts, how more people are becoming active, how the healthcare burden is reducing, how their savings in their families are improving. And then it got recommended to the GST Council. And only then the GST Council and the Committee of Ministers then approved it, and then the Prime Minister announced it. So yes, several studies have been done on this, on the positive impact of our program.
Okay, I think so. Maybe to a level we have covered it. If that is what I assume Dr. Srivatsa wanted to ask. Now I am other question. You spoke about combining your physical model, sedentary behavior with nutrition and everything together, right? So that means you have nutritionists who are part of that, your team. And
Yes.
what about when you're trying to customize it? Is it any preset template you're following, or you're customizing it, or what? And the second, you are collecting, once again, I come back to that, you are collecting patients' data.
Yes.
Right? Whether it is their health data, nutrition data, whatever it is, right?
Yes.
So what about the privacy, security, confidentiality aspects? And then how are this data being maintained? Who is the sole owner?
Okay.
These are my questions.
3 questions, and I'll also give you a 4th one. Okay. First, yes, ma'am, nutritionists are hired by us. Each nutritionist is highly qualified and must have done at least 10,000 cases from wherever they've done it, Max, Apollo, wherever they've come from, their background, but they must have attended 10,000 patients before they get hired by us. Over the last 10 years, we have been able to use AI to a level where I can coach your body, because your body only moves in 130 different ways. Okay, your head can only go, your neck can only go up, down, left, right, and rotate. There's no fourth movement. All your limbs only have defined movements. So what exercises I should give you is a combination of 130 different ways your limbs can move. Combination of that is called exercise. Combination of exercise is called circuit. However, we are not able to do that for nutrition in India, because we're such a large country and the same vegetable has so many different names and there are so many different. So it is a very human-led approach. And also we have understood over the last 10 years, serving crores of customers, is that with a nutritionist, you establish a bond of trust. You talk to them as to why you have triggers at night. Why do you want to eat? What are your stress triggers? There's a bond of trust. What are your mental issues or what are your other issues in life that force you into not being able to stick to a regime or give you all these triggers? So all of that cannot be replaced by AI. So it is 100% human-led, AI-assisted, the nutrition program. And I think that is what drives the success, because in all of this fitness, only one thing people need to understand: not everybody has to become Hrithik Roshan or Brad Pitt. And which is what our line is, that any activity is better than zero activity. So you have to keep people moving along, nudging, because in people's mind, they think it is 0 or 100. Either I'm Hrithik Roshan or I'm nobody. But you have to make them understand that everything you do actually compounds, like your SIP compounds, actually your health returns compound the same way. Third, for your data. So ma'am, we are GDPR certified actually, because we have to work with not only Indian insurance companies, but international insurance companies, reinsurance companies. We work with banks. So I don't think anybody has so much security as we do. Everybody's data is kept on separate servers, because a Care Health insurance company customer and New India's customer are very different. They cannot be overlapped. The data cannot be shared. We own the data. In fact, now we have just received approvals from the government for what is called the AGBA ID. We were telling the government that you were trying to put everything about somebody's diagnostics together, right? But what must also go with it is what was the resting heart rate for the last so many months? What were their sleep patterns? What were the steps they were taking? What were the activity levels? And the government loved it. So finally, we've got both all M1, M2, and M3 approvals. That not only can we pull data, but we will publish it back so that you know. So for data security, I think we went through their approvals also to be compliant. So who owns the data? We do, which is what IRDA also likes, that because IRDA trusts us so much, they said if somebody is following the FitPass regime, they should get discounts on their insurance premium, which means they should not commit fraud with me and I should not give wrong data to the insurance companies. Because if I'm publishing wrong data to the insurance company and somebody is incorrectly claiming a discount, then whose fiduciary responsibility is that? It is FitPass's.
Okay. So that means you are taking the consent of the persons, those who are becoming a member,
Yes,
that you are storing their data, number one.
yes,
And as of now, you have not yet become ABDM compliant. You are
but
going to be,
we've got the approval.
you have got.
We've got the approval, but integrations are on. Then testing will happen. Then we'll publish.
So then what will happen to the older data which you have collected?
Older data for customers.
Yeah, for your customers. Some of them, they would be having their ABDM number.
So I think once we start,
ABA number. Yeah.
So we don't create new ABA numbers.
No, it is, you don't need to create. It will be already created, or through your application also you can create for people those who are not having the number.
Yeah, that option the government has given us, and they give
once you are
also,
integrating it,
and they give you some money also to create it.
Yeah.
So we have not explored that yet, but I think we will have to check actually with my CTO what the protocol is, that what data we will publish, one that we currently have, or even the older data, or how old data can be published.
Because now you're going for ABDM complaint. One of the option would be that whatever government is giving the feature, that is just to enable people, those who have not yet who have created the ABA ID, by using this new digital application, they are given a chance to create their ABA ID also.
Yes, ma'am.
So maybe that you need to integrate into it. And second, you can, whoever your new customers are, you can ask them already whether your existing members to update their ABA number. That way, it will be a win-win situation both for the government, for your customers, and for yourself. Okay,
yes, thank you. Thank you for the suggestion, ma'am.
Yeah, so Akshay, couple of observations. While you were talking, I was visiting your website and clicking on a couple of gems. So 80% of clicks results in application error. So I think this is, well, you're presenting an innovation, tech innovation. This should not really happen, right? So 80% clicks are going waste. When I am clicking on swimming, it does not really show the swimming, it shows the gyms. But let me understand how many users you have and what kind of revenue you're generating.
So we are at about 174 crores of revenue.
Okay.
We are a
And
profitable. We've
so-
been PAT positive since
Okay.
COVID reopened. We were shut down for 21 months during COVID with zero revenue.
wonderful, wonderful. Quite a
And-
tremendous
and-
revenue generation capabilities you have built. Now, so how do you really share the revenue with gyms, the member studio, health studios with you?
So
So you charge a monthly subscription. What
we pay
percentage
them.
goes to them?
So depending on so it is exactly like Uber or Airbnb or let us say health insurance. Wherever the customer is going and utilizing the services, they will be paid according to the services utilized. So as a health insurance customer, it is my decision where to get my kidney stone removed, whether I go to Apollo, whether I go to Max, whether I go to the hospital nearby, and wherever I go, the claim is paid. Similarly, as a customer, so you have 8,000 gyms and fitness studios, some close to home, some close to office. Wherever you go, wherever you use, that said gym or studio will get the payment.
Okay, so you make the payment to the gym, but
Yes. So
this
we don't charge
3,000
the gyms.
subscription, this 3,000 subscription or 1,500 subscription which you're charging,
Yes.
this is for what?
This is for, so now you are a FitPass member. Basically, you're a member to 8,000 gyms. You can go anywhere, work out anywhere. You have unlimited nutritionist support. You have unlimited AI fitness coaching support. You have virtual classes. You have unlimited doctor consults. You can speak to 17 specialties. You have a
No, so there's
So
a
this is
catch,
what
right? So so let's say when I visited your website, I was getting a assumption. I was assuming that if I pay 3,000 to you, I can really access any gym in Powai
you can.
or in
That's correct.
Andheri or
Yeah,
no, but
that's
I have to pay additional money to that gym as well.
absolutely
day.
not. No, you don't have to.
Okay,
We
so
pay
that
them.
is what my question is, that this 3,000 rupees subscription you're charging, how much money you pay to these gyms?
So our gross margins are 54%. So 46% of our subscription amount goes to gyms, depending on utilization. So we negotiate rates with gyms, like in health insurance company negotiates rates with a hospital. That maybe the market rate for a kidney stone removal is 1 lakh rupees, but when claimed through New India, we pay you 40,000.
So let's say one user, he takes the subscription and every day he keeps on switching the gym.
No, that's fine. So
how you will be able to keep a track and pay the money to those gyms?
That is where the tech is, sir. So same way Uber has a partner app, our gyms have a partner app. So when a customer goes, our QR codes are pasted everywhere. So when a customer goes, they scan the QR code and they work out. That QR code scanning tells the partner that a FitPass customer has come. Their bill gets generated through the partner app, and we make the payment.
Okay, fantastic. And you have a flat pricing for the India, right? So you don't have the differential pricing for different cities. Like, for example, there B class town or C class town, right? So there people will not subscribe to your 3,000 rupees per month subscription. They may really go and directly get the subscription at a much cheaper rate. This is good for cities like Bombay or Delhi or Gurgaon or Bangalore.
I think, sir, that is why the narrative is different, because actually we are present in 130 cities, and the best cities that we have are actually tier 2, tier 3 cities. Because I think the value is not just access to gym. Even if you take a normal nutritionist who works with you on WhatsApp, will charge you 3,000, 4,000 rupees a month, and you will have no data, you will not log your meals. But here, your nutritionist is included. If you wanted to talk to doctors in Max or Apollo in Delhi, it might be tough for you to do, or you might have to go through other telehealth providers. You have to pay 500, 600 rupees an appointment. That is also included here. Your health checks also included here. So in that 3,000 or 1,500, it is not only access to gyms. It is everything you need to be fit, feel well, and do well. So it is gym.
Wonderful.
So
Great. Got it. Yeah. Got it. Fix your tech, right? That's
so I'm very surprised you're saying that,
that's quite a bit.
I was just checking. Maybe it's the app, or maybe I don't know. So it shouldn't be that way.
Yeah.
Okay. Thank you for the feedback.
Okay. Thank you so much, Akshay. Wish you good luck.
Thank you, sir. All the very best.
Thank you for the presentation, Mr. Akshay. Very well
Sure.
presented and answered